We are fortunate to have Helayne Jones, President and CEO of the Colorado Legacy Foundation, here to share with us.
Good morning. Thanks for letting someone from west of the Mississippi come talk to you about health and wellness, because in Colorado we actually believe that we are going to be the healthiest state in the nation, and we're on the way to do that because we're moving health and wellness into an integrated statewide approach. I represent and CEO of the Colorado Legacy Foundation. We are a new, becoming national model for what can happen with a public-private partnership. We're an independent nonprofit that supports the Colorado Department of Education around implementing and accelerating the rate of implementation of key reform initiatives. And we see health and wellness integrated across all state education policies as a critical key need to make school health and wellness sustainable. It's great to have a program in a school, and it's great to have a district doing work. But if we don't find a way to make the connection for every educator who knows in their heart that there truly is a connection between a student's health and wellness and their ability to learn. And in Colorado, that's our approach. At the Legacy Foundation, we believe that improved student outcomes will not occur for every child in Colorado and in fact in the nation, until we have an effective educator in every school classroom, an effective leader in every school, and a healthy and engaged student in every seat. And how are we doing this in Colorado? We're doing this by taking a systemic approach that really focuses on some key elements: standards, accountability, measures of effectiveness, and incentives. We are implementing, thanks to the State Board of Education, comprehensive health, PE, and social-emotional standards across all of our new academic content standards, which are based on the Common Core. As part of our new educator and school leader evaluation system, we actually look at the integration of a student's health and wellness, such that a principal will be evaluated on their ability to grow the cognitive, physical, emotional, and engagement of a student, really looking at the student holistically and not just measuring academic outcomes. We at the Colorado Legacy Foundation are supporting the acceleration of these standards by helping staff a full-time health and wellness standard-focused person who is working at the department across all content areas. Additionally, we look at accountability. We have statewide school performance frameworks similar to what you're doing at the district level in Chicago. We're actually looking to do that statewide. We have started the collection of common performance metrics for every school district in the state. And we incent schools to do this work. And how do we do that? We have a voluntary Healthy Schools report card that is celebrated every year. 54 schools were acknowledged this year with financial supports for really recognizing the importance of doing this work and shining a spotlight on innovation. We have 178 school districts in Colorado, and a lot of them are quite rural, having less than 1,000 students. So while some people say, well, why focus on those rural school districts if they're so small? In Colorado, we actually believe and are implementing in state policy that a child's education should not be determined by their zip code. The importance of health and wellness does not diminish as your school district size gets smaller. It should not diminish if your superintendent is also the cook and the bus driver. Actually, what we found is it's almost easier to make innovative change in small districts because they're learning how to do as much as they can with less. Our goal in Colorado is to actually change from within, that we believe that if we can get every educator to understand that connection and support them in their ability to support the health and wellness of every child, we will ultimately increase student outcomes for all students. Thank you.